I don't say don't, and I don't say can't. I just say I can, and I will. And I do.
People who don't know her should know her, and I would love to introduce her to the world and let them know that here's a spirit that cannot be contained.
I worked in OBGYN, city hospital emergency department, family health centers, teaching students, and then I was tapped to the medical board in New York. All of those opportunities, I was the first PA in many of those settings. And as a pioneer, you don't always know what the rules are. You kind of make them up as you go along.
Robin has shown from the time she joined to the Federal Bureau of Prisons that she really wants to be a change agent and make change that affects large numbers of individuals, not just in single clinical encounters. And Robin almost single-handedly, through her initiative and her energy and her vision, has established Butner as a diabetes center of excellence.
She's doing something that is really new to the Bureau. She actually is the point of contact between the group of diabetics and the clinical side of the medical center.
She has had a great impact in the lives of these inmates. The majority of them have never had anybody educate them this way.
Incarcerated men are medically underserved, and they're also medically illiterate. When you teach the patient how to take care of themselves, they actually do better. Their outcome is better. They feel better. It feels good to know that I've been able to help them.
When the inmates deal with her, they do respond by trusting her. They know that she's not going to let them down.
And I often will say to them that I'm not the judge, I'm not the jury, and I did not sentence you. But for the time that you're here, I will do the best that I can to take care of your health needs.
She sees those patients as people in need of her care. She's not interested in why they're there, what happened to them, what they did. She's not at all interested in that.
I try to focus on the patient in front of me. And by focusing on the patient in front of me, then everything else is secondary. And listening to their story, addressing their needs, and sharing a secret or sharing how they feel about something. And I think patients recognize that because they come back to that time and time again.
She has an internal compass that tells her where she's supposed to be and what she's supposed to be doing. She's called, and she answers her call very freely, without hesitation.
I keep finding new challenges and new experiences that I thrive on. So if this is what my calling is, I'm going for it. I enjoy it.
Robin is the most outstanding physician assistant I've ever had the privilege of working with or knowing.
This is such a well-deserved recognition for someone who has worked quietly and diligently throughout her entire career, not asking anything in return. And she's probably the most deserving person I could think of to have this moment in time for people to just stop and acknowledge her.